Welcome to the Bearcats Den with President Taylor. My name is Ivy Taylor and I'm president of Rusk College. On today's show, we are joined by two very special public servants here from Holly Springs. We have Dr. Kenneth Williams Md and Dr. Greg Stallworth Md. Dr. Kenneth Williams is a native of Moss Point, Mississippi, and he graduated with his bachelor's degree from the University of Southern Mississippi and earned his medical degree from Meharry Medical College. Dr. Greg Stallworth attended Elmhurst College in Illinois and also attended Meharry Medical College. Both of the doctors work here in the Holly Springs community with the Alliance Healthcare System. Welcome, Dr. Williams and Dr. Stallworth.
Thank you for having us to the den.
Absolutely. Absolutely.
We're very excited to have you here in the den today. I wanted to start out by asking Dr. Williams a question because I mentioned that you're from Moss Point, Mississippi.
Yes.
What I didn't note is that you are a fourth generation physician, which I thought was extraordinary. Will you tell us a little more about your family?
Well, of course, I grew up in Moss Point. My dad was a dentist in Moss Point, and his father was a dentist in Columbus, Mississippi. And my great-grandfather was a physician in Marshall, Texas. And of course, I told you in the past that I had a connection to San Antonio, and that's where it came from, San Antonio.
Okay.
And actually, I have a daughter who's finished my hair. She's a fifth generation. And she's a chief resident at Tulane University in internal medicine right now. So she's the first woman, so we're very proud of her. Yes.
What an extraordinary family history. Was there a lot of pressure that you had to go into the family business?
No pressure, no pressure. Yeah, I tell people all day long, you know, if you grew up on the farm, chances are there's a good chance you might be a farmer because you're around it. My dad never pushed me to go into medicine or dentistry, and it's just one of those things that it happened.
Okay, and Dr. Stallworth, how did you become interested in a career in medicine?
I had three wishes I wanted to do. I either wanted to be a lawyer, a doctor, or a minister. And certain things in my life pushed me to medicine instead. I probably would say my sophomore biology teacher, Elaine Bailey, really had the most influence on me. The minister, he came by the house one winter. I'm from Chicago. And my mother offered him some eggnog. And of course he said, "Can I have that spiked, Eunice?" And I didn't know what spiked was, but I knew not to ask then. So when he left, she said, "Oh, that's a little liquor in it." So that kind of blew my thing about a minister. You know, at age 10, you thought everybody was, "Oh, what?" So, and then law books were just writing. It's just too much reading to do with that. Whereas in medicine, you had diagrams and pictures and other distractions besides just reading.
Okay. Well, congratulations to both of you for your many accomplishments, and thank you for the manner in which you serve the public. Well, the viewers can see that we're talking through our masks today because we're sitting a little closer to each other. I wanted to have the opportunity to chat with you both as healthcare professionals to weigh in on what's top of mind for most of us nowadays, which is the current pandemic that we're in, COVID-19. Will you share with us what you've observed here in the area and any advice that you would offer to our viewers regarding staying safe and being healthy?
Well, first of all, I'd like to say that this virus is no joke. It's been politicized, and I had a patient in the office today, and the first thing that she said to me was, I don't know if this is real or not. Of course, she did have a mask on. Mm-hmm. And I told her, I said, we've taken care of several people in the hospital here. Fortunately, up until 2 weeks ago, we hadn't had any deaths. But if you've seen anyone get really sick from this virus, it'll tell you that this is nothing to play with. And Dr. Stallworth will attest, we've had patients as healthy as in their 40s that we've had to hospitalize. And we've had patients up to 100 years old that have had the virus and survived it. But they got very close to death and deathly ill. So it is a real infection. The mask is mighty important because it's primarily respiratory spread. But yes, it has, I think the last count they had around 10 to 15 deaths in this county. But we've only had 2 at our hospital, so we've been really proud of that.
Okay, thank you. Dr. Stallworth, what would you add?
Well, we've had about 15 patients. Like Dr. Williams said, masking is very important. There are two types. You've probably heard of the N95 mask, which really protects you. That's what Dr. Williams is wearing, the N95. It prevents the droplets from getting to him. Whereas I have just a regular surgeon's mask, and what it does, I prevent me spreading the virus.
Okay.
So the regular mask that you see most people wearing really protects others, whereas Dr. Williams will help protect him. The other thing, hand washing is very important. The virus is covered with a fatty substance, and soap helps denature it, kind of like when you put that greasy pot into the soapy water and it breaks down the grease. That's what happens to the soap, and that's why soap is so important for that 20 seconds washing. That'll help kill the virus off of your hands. And of course, don't touch anything like your face, your nose is very important as well.
Okay, that's all great practical advice. That was very interesting hearing about the two types of masks. Another type that many people are adopting as a little bit of a fashion statement are the fabric masks. What can you suggest? Should we layer another type of mask underneath a fabric mask?
The whole thing about masking is how thick it is. So one thing they recommend is if you can take a candle and hold it about 6 inches away and you blow, and if you can blow that candle out, then your mask is too porous and it's allowing droplets to get out. So you may have to double mask. The ones that now look like turtlenecks, a lot of those are very thin. So you have to be aware, and some homemade masks as well. So the thing is, you want to make sure that the droplets aren't escaping, so they should be thickened and probably double masked. Of course, you don't want to cover up rust. But
Thank you, that's great advice. Well, here at Russ College, we've been blessed as well. Even though we have students here on campus and residents, we have not had any cases amongst our students.
Wow,
we
awesome.
have a little more than 300 students on campus, and we have almost 600 enrolled. Some are taking their courses remotely. We did have one case of an employee, and that person thankfully recovered, and none of the employees who worked in the same office contracted the virus. What advice would you give to our young people, our students in particular, who feel that they're young and they're invincible, as they're here on campus? What would you tell them regarding staying safe?
Well, you know, it's hard to tell a young adult not to congregate, not to stay 6 feet apart, which is really important. But you're wearing your mask, as Dr. Stallworth said, and having the proper fitting mask is important too. You see a lot of people walking around with a mask and the nose can be out. Well, you know, you still can get respiratory through the nasal passages, you know, so it's important that and you can still have fun with each other as long as you do your precautions, you know, and washing your hands, using the hand sterilizer, wearing your mask, you can still have fun with your classmates. And I think that's been one of the problems, and they have been a little negligent and sometimes in warning, because they feel like nothing can really happen to them. And all it takes is one student to give it to someone else, and then all of a sudden it's full blown.
Yes, we are doing our best to be vigilant here. We've issued Russ College masks to our students, and we have markers on the floor throughout various buildings reminding them to be socially distant. And of course, our classrooms have a maximum number of individuals that can be in the classroom. So we're doing everything that we can, but we, again, need the cooperation of the students, because as you mentioned, it just takes one student to go to an off-campus party where folks are not practicing those same procedures, and then we could have a different outcome.
yes.
Well, let's shift gears for a moment, and I'd like to learn more about the hospital, which I understand you, Dr. Williams, have owned for almost 21 years. Tell us the Alliance Healthcare story.
Well, Alliance Healthcare, in 21 years, time has moved on. But when I first came here, which was 30-something years ago, I was a physician at the hospital, and it had been through several different owners. When I started practice here, Methodist Hospital System actually owned the hospital. But it went through 2 or 3 more owners, and then finally the last owner had filed paperwork to close it. So I had 2 other physicians that were at the hospital at the time. This was before Dr. Starworth. I wish he was here. but it was before them, and we were supposed to get together and save the hospital. And when it came time for that to happen, the other 2 physicians didn't show up. So I was left by myself. But once you develop relationship with employees, the community, and it was really built out of that. And I knew that I had someone that I thought could run it. My uncle happened to be in hospital administration back from Atlanta. He was at his alma mater at the time, Tougaloo College in Jackson. So I called him. I said, if I end up getting this hospital, will you come help me? Because I don't know a thing about running it. Mm-hmm. And he said, if you get it, I'll be there. And sure enough, he showed up, was a tremendous help in understanding the hospital. And we've been in business for 21 years. It's a small rural hospital, 40 bed, but we are working on a newer facility.
Wonderful, congratulations, and we appreciate you having the vision to preserve a hospital in a more remote area. And I know just from reading that it is difficult for folks that live in rural areas to access quality health care, so we appreciate your commitment to continuing to provide that service. Will Dr. Stallworth tell us about your tenure with Alliance?
Well, I'll be 20 years in next August, actually. And Dr. Williams has been a godsend for the community and providing healthcare services, because a lot of services, you might not necessarily need that heart bypass at 2 o'clock in the morning, but when you have that baby with a fever at 2 o'clock in the morning, what do? So our ability to be here in the community and provide primary care has been a godsend, and he's tried to bring in specialty services too, sometimes successfully, sometimes unsuccessfully, depending on the individuals that come and what their outlook is as far as providing the service.
Wonderful. Again, we really appreciate your presence here in the community. Again, we are here with Dr. Kenneth Williams and Dr. Stallworth. We'll be back in just a moment. And now we'll hear from the world-famous Russ College a cappella choir under the direction of Dr. Arlandra Harvey. If ye love me, keep my commandments, and I will shall give you another comforter, that he may abide with you forever, that he may abide with you forever. Welcome back to the Bearcats Den with President Taylor. I'm your host, Ivy Taylor, and today we have as our guests Dr. Kenneth Williams Md and Dr. Greg Stallworth Md. Dr. Williams, you just mentioned a factoid about Alliance Healthcare that I think everyone should know about. Will you share?
Yes, Alliance Healthcare for the longest, and I can't say today with 100%, but we were the only privately held minority hospital in the whole United States, which was very unique and a fact that I was very proud of. And in light of the Black Lives Matter movement, you always hope that the community and people, your own people, will appreciate what you're doing and what the institution that you work for are trying to utilize to help your own people will understand. So we're very proud of that fact.
Okay, well, let's pick up on that thread of the conversation for a moment. When people hear the refrain Black Lives Matter, nowadays they usually think of the fights related to criminal justice and police reform. However, that slogan really does apply across many facets of American society. And one area that I know you two can speak more eloquently to than I can is the fact that there are often disparate outcomes, disparate health outcomes for Black Americans than for the general population. Dr. Stallworth, would you like to comment on that?
Well, health disparity is our reality in the country. We find that premature birth rates are very high in the Black community. Cancers, diabetes, hypertension, a lot of it related to diet, a lot of it related to stress, colon cancers. I think that's kind of big now ever since Chadwick's passing with colon cancer. It's kind of behind the scenes and wasn't really something you don't want to talk about. I had a patient today, I was mentioning colonoscopy, and it's kind of like, whoa, is there another way to go? But one of our workers had a positive colon test, their Cologuard test, which we offer to kind of screen for colon cancer. So we have to raise awareness and try to make people do the right thing. Like we were talking about masking in our young folks. A lot of times you have to lead by example. And I think that's one thing Alliance does. It provides something in the community that people can see. Just like people saw Black Panther and they could visualize that, I think they can see Alliance, like Russ College. They can see that and say, I can go to college, I can be a doctor, I can be a x-ray technician, I can be a lab technician, a nurse, I can be in healthcare administration. So I think we provide that example.
That's wonderful, but you can't pursue any of those things if you don't have your health. Health
That's
is
right.
wealth.
Right.
So, Dr. Williams, would you like to comment a little more on what you've observed related to disparities in health outcomes?
Well, it is interesting. 20 years ago, I was featured on CBS Evening News, little program, and doing that filming, I noted that I wanted to see how we exacted change on the statistics in our community. And I can honestly tell you that at the time, it's 82 counties in Mississippi, and we were near the bottom in almost every healthcare statistic. People didn't recognize it, don't know about it, and we diligently tried to work on it. Now, we are now in the top 20 in this whole state, in the state of Mississippi, and we haven't put all of the plans that we have in place, but that's working together. That's also understanding your people, communicating with them, and the ones that are not scared to come see you,
Yes.
and that are lost in another time, they're realizing you are there to help them, not to hurt them and not to earn a dollar off of them. You're there to be a part of their lives. And that's really important to change the mindset of the community. And we've done that in a lot of cases.
Well, one of the things I'd like to follow up on that Dr. Stallworth mentioned, some of the disparities are related to life choices we make, such as diet and exercise, or the lack of exercise.
Push.
I've lived in a couple of different areas of our country and have noticed the different eating patterns in different parts of the U.S. One area where different community members have been able to effectively partner with healthcare providers is on prevention, especially around diet and exercise. And so I wanted to mention that I would love to have the opportunity to to work with you two and your colleagues at Alliance Healthcare and bringing greater awareness to our community here in Holly Springs on how people can take control of their own health and wellness.
We accept.
Wonderful.
Okay.
And we do have a preventative health program at the hospital.
Oh,
And
okay.
so we have a preventative health department. And there are a lot of things that are out there that insurance companies, Medicare, there are a lot of things that Medicare will pay for that they just don't know about.
Okay.
And so we love to be a part of that.
Okay, well, I will look forward to that partnership. I'd also look forward to learning more from you all to be able to share with our students on what some of the opportunities and options are for them regarding careers in healthcare. Would y'all like to comment? If you were young and coming out of Meharry right now, or if you were in college right now, what do you think young people should be thinking about as options?
Let's start with, I can answer this, but
Now you go ahead, because
Okay.
he has children that are students.
Okay.
There are all kind of careers in health. That from pharmacy to nurse practitioners to physician assistants to respiratory therapies. There are all kind of, the healthcare field is wide open. And the fortunate part about it is most of the jobs at healthcare are good paying jobs. As I had mentioned to you several weeks ago, we tried to partner with Rust a little bit years ago to put a 2-year school near the hospital, the supposed new hospital, for those type of careers, respiratory therapy, surgical technician, LPNs, RNs. And I hope that's some dialogue that we can have with you as president, because the kids that are not going to go to 4-year colleges are going to go past that. They can get a 2-year degree in the good paying fields, and they can work anywhere in the country. But it also gives those local kids an opportunity to stay here and have a high earned, a really good, decent salary.
Yes, and it also gives them the chance to start working and still continue their education if they
absolutely.
want to pursue a 4-year degree or higher education as well. For some people, having the opportunity to work in a good paying field would open up more doors for them in relation to education. Would you like to add anything to that, Dr.
Well, you
Stallman?
have paramedics, ambulances. I'm sorry I'm getting a call. I have emergency room duty right now. This is the hospital, but
Okay.
Fields are wide open. You can find something that will fit you. Some people say, I can't stand the blood and the guts, but there are other opportunities that you could do where you wouldn't have to necessarily be involved at that level.
Okay, well, we know how important your job is. If you have to sneak off, well, we won't hold it
Right.
against you. But let's talk a little bit more about colon cancer, as that's an issue that's, as was mentioned, top of mind right now with the unfortunate loss of Chadwick Boseman. What do you all recommend, in your professional opinion, regarding screenings for colon cancer or colonoscopies?
Well, initial screening is actually at age 50. If you have a family history, then they recommend you start earlier at age 40. Now, there are some really bad family members, they'll do it at 35. But 50 is the norm. A lot of people do not want to have a colonoscopy. That fortunately, they do have other tests like Cologuard, which a lot of the insurances will pay for now. Is they collect a stool sample and they look for the DNA in the stool for particular types of cancer. If you do get a positive Cologuard, you still ultimately have to have a colonoscopy anyway, but it can, if it's negative, there's a 94% chance that you don't have colon cancer. So there are options out there besides getting a scope done. The key to it is getting something done. As you know, we talk about colon cancer, disproportionate, prostate cancer, disproportionate, breast cancer to a certain degree is disproportionate. You know, if you keep looking at the data, everybody say, well, look, why are things disproportionate with the black community? And, diet has a lot to do with it. Genetics have a lot to do with it too. But a lot of it also has to do with early screening and getting the proper test done and catching things early.
Yes, I would certainly agree with that assessment. A few years ago, I read a book. I cannot remember author's name, but the book was called A Black Man in a White Coat, and it was a memoir by a black doctor, and he talked about those disparate outcomes, and he talked about his observations of how African Americans were treated within the healthcare field when they're not dealing with black doctors. And that's an uncomfortable fact that we may not like to talk about, but it also points to the fact that we need to have a pipeline for more black people and minorities to actually enter the field of medicine.
And if I could just add that self-awareness is so important too. You know, don't be scared to look at your stool and see if it's changing caliber or color, or check your breast, or look for some changes that, boy, something's wrong, and don't just, after 2 weeks, if it's still bothering you, get it checked out. Don't wait 2 years down the line and say, what is this lump? And maybe the horse is outside the barn by that time.
You know, that's a great observation. I kind of chuckled when you said to look at your stool, because my grandmother used to always tell me to do that. And I would say, oh, Nana, please, let's not talk about that. But you're right. Those are things we need to deal with. And I had an employee once who had some sort of lump or knot, and she went for an initial test, but then she said, I was afraid to go back and get any further results, and she didn't go. It took her over a year to get the courage to go back to the doctor, and by that time, like you said, the horse was already out of the barn, and unfortunately, she ended up dying from cancer that may have been able to be treated earlier on. So,
a lot of times we're like the ostrich, and we put our head in the hole and don't want to know, instead of saying, let me find out what's going on. And some of it is also, if you go to someone to get something checked out, and they aren't, if you don't hit it off with them, you may not want to go back if they're kind of condescending or kind of put you down, or, you know, that's important in your healthcare provider to have that type of, it's like your teacher, you know, you have to kind of have that understanding with them.
yes. Would you add anything on that?
Well, weight loss, you know,
Yes.
weight loss sounds so simple, but if you've lost 20 pounds and you're not trying to lose 20 pounds, that's a key. Something's wrong. Let me go see the doctor and see if I can figure out what's going on. It ultimately, that is probably the easiest sign, and people around you can notice, because you know whether or not you've changed your diet to lose 20 pounds. So,
Yes, that's a good observation. My mother, she used to suffer from thyroid issues, and she said that she would lose like 10 pounds overnight, you know, wake up in the morning. And so that is a good indication that there could be something that you need to follow up on. Well, I know I feel better knowing that you all are here to address our issues. What else would you suggest as far as members of the community coming for preventive care? I know the hospital has an ER, and unfortunately a lot of times people go to the ER for health care. What would you suggest would be a more proactive approach?
just coming to the office. You know, don't be scared. Even with the COVID, we still are seeing patients in the office.
Okay.
And talking to someone. Everyone that we have in our practice is a good people. And Dr. Stallworth, we got 2 nurse practitioners, Nancy Boatwright and Richard Wiseman. We have white, black, Hispanic. We want to be open to all races and all people because we all have health problems. So, but first thing you got to be, don't wait until you get sick. Come through the door for preventative health, to get a checkup, especially a yearly check, even if you're young. Most insurances do cover it, a yearly checkup, and some of these Medicaid insurances now will even do blood work that they'll pay you to come get it done, you know. But go see, come see us.
I think that's a great point you made, because some folks have been hesitant about going to the doctor because of COVID and not wanting to be in the medical space at all, or feeling that doctors have a bigger priority right now to tend to those with COVID. So thank you very much for those reminders for us to be proactive about taking care of our health. I've really enjoyed our conversation with you 2 doctors today.
I did as well.
Thank you very much for being here. I look forward to working together in the future.
Very well.
Thank you.
Thank you all for tuning in to the Bearcats Den with President Taylor. We'll see you next time.